we will talk about gradual vision loss or causes of blindness. You may ask if it's possible to retain 100% eyesight even old ages. It's not possible. Even if you are healthy and no eye disease, you will lose around 15% of eyesight. Another thing what will happen is unable to focus on near objects. It is called presbyopia and it's universal process to everyone. That's why people using reading glasses after age of 40, because people when they get old, lens becomes more raw and difficulty to focus, and lens loses elasticity and also ciliary muscles losing strength, and lens can't focus well. That's why it becomes difficult to focus on near objects, and usually people using these reading glasses, which are usually +1 or +2, it is called presbyopia. It's universal process and it's not considered disease because it happens to everyone. Second important change is difficulty reading in low light or difficulty focus on low light. It happens because our retina receives less light, because when person get old, his pupils becomes more constricted and less light reaches to retina. Also on the retina there is less photoreceptors, and that's why person is unable to read in low light conditions. Now let's talk about diseases which causes gradual vision loss. Such disease is age-related macular degeneration or AMD. What is macula? It's retina. Retina is central part of eye. It has photoreceptors and it gets light, and this light is converted as an information, as an image in our brain. That's retina. Retina has macula. Macula is area where there is lots of photoreceptors. It's not here. Many people think that it's macula. It's not macula, it's optic nerve. Here is macula. There is lots of photoreceptors, and it's important to vision and visualize details. For example, face details or sharp image. If you want sharp image and if you want central vision, you need healthy macula. If macula is not healthy and it's degrade, we have distorted vision. We have our central vision is distorted and blurred, and person can't recognize faces, and it's very difficult and problematic for person because he has no central vision, and it's not reversible process also. That's why it's important early detection of macular degeneration, which is age related. And what we see on retina, we see this yellow spot which is called drusen. Drusen is small particles of cells, of retinal cells, and these small particles are deposited here and they damage retina further, and neovascularization occurs. New blood vessels are created, but these new blood vessels are chaotic and it does not help retina, but it creates new problems on retina. Age-related macular degeneration, it usually occurs after 65, and after 65 it affects around 50% of population. And what are risk factors for age-related macular degeneration? Smoking, obesity, age, and ultraviolet exposure are important risk factors. Now let's say about second important disease. It's glaucoma. Glaucoma also causes irreversible blindness. That's why it's important. And idea of glaucoma is damage of optic nerve. Why? Because of intraocular pressure. This is eye, and you can imagine here is pressure in the eye. In case of normal, it's okay, everything is okay, but if this pressure is increased, it press the retina is here, and it press optical nerve is here. It press optical nerve and it damages over time, and it causes vision loss. Usually this disease develops silently over years, but when in advanced stages we have peripheral vision loss. You can see what is peripheral vision loss. Person will see in the center but unable to see periphery. Peripheral vision loss is glaucoma. It's opposite of macular degeneration. In case of macular degeneration, there is no central view, and in case of glaucoma, we have central view but no peripheral vision. It is also called tunnel vision because it looks like tunnel. And we have treatment. It's important. Early detection is important. Early detection is best way to prevention, because if we measure intraocular pressure and it's high, we can treat before blindness occur. It's important. Prostaglandin analogs are effective. They decrease intraocular pressure around 30%. Surgery is effective. Beta blockers are effective. So we have effective treatment which can slow down progression of glaucoma and avoid blindness. That's why early detection is very important. We also have another form of glaucoma, is acute angle closure glaucoma, and it develops very fast and sudden and causes pain and vision loss. But in most cases, glaucoma develops very slowly, but if blindness occurs, it's irreversible. And now let's touch reversible blindness. It's cataract. Cataract is very common disease. It affects almost, on some degree, it affects almost 60% of all population. So it's very common disease, but very important is that it's very reversible and treatable. And what is idea of cataracts? We have lens here inside, and this lens is clouding, and this lens is composed of proteins and water. In normal case, here should be proteins and water, but these proteins clumping together and they clouding this lens. And what person sees, person has blurred vision, colors are faded, and there is cloudy vision also. You can see hazy vision. It's problem for person, but even in severe cases, person will be blind, but this blindness is treatable and reversible because we have treatment. Surgery is very effective, and it's treatable condition. That's why cataracts is not considered very huge problem in view of blindness, because it's reversible. The idea is clouding of the lens. And what causes risk factors? We have trauma, diabetes, corticosteroids, ultraviolet exposure. They are risk factors for cataracts. And let's touch diabetic retinopathy, also important disease, because 30% of people who have diabetes have also diabetic retinopathy. And what's diabetic retinopathy? High blood glucose level damages small blood vessel, and this damage causes many changes in retina, like hemorrhage, microaneurysm. You can see these small dots, they are hemorrhage. Lipid accumulation, you can see these yellow spots, they are lipid accumulation. And eventually retina is destroyed, and we have lots of symptoms here: blurred vision, floating spots and flutters, dark or empty areas in the vision you can see. So we have lots of different symptoms because whole retina is destroyed over time. And here also very important to detect and prevent this degradation and retinopathy. And the best way is blood glucose level control. That's most important, because if retina is damaged, it's very difficult to recover, and complete recovery is impossible. So it's also irreversible process. That's why prevention is best method, and blood glucose level control is best method. Laser photocoagulation also used, and it prevents further destruction of retina, but best way for prevention is still blood glucose level control and cardiovascular health. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my video, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.